hyoids, I have good news for you, kind news, I would say, for you, in that the hyoid muscles, there's about 8. And I'll explain why I say about 8, because you could argue there's 7 in this other one, but there's 8. But I'm not going to have you memorize the origin and insertion of all these hyoid muscles. It's just important you know they exist because you've all touched them without knowing it. If you push on the bottom of your jaw here, the reason it doesn't just feel like skin and there's a little bit of firmness there, that's a hyoid muscle. It's called the myohyoid. And so you've got, everybody do this, take 4 fingers here and do this and say suprahyoids. Thank you. Now just bend your hand down like this and say infrahyoids. Super accurate. There are 4 suprahyoids that live right about here. Don't get me wrong, some go back in your neck, but they're here. And literally, if you flip your hand down, there are 4 hyoid muscles, infrahyoids that live down here. Suprahyoids above the hyoid bone, infrahyoid below the hyoid bone. That's it. See you guys later. It's close, I'll tell you. If you just knew that, you'd know more than most therapists out there. Most therapists don't study the hyoids. So we're going to look at them, but we're not going to memorize the origin and insertion of all the hyoid muscles. It's not a good thing to put in your brain. I'd rather you learn flexion and extension. All right, here we go. Boom. Let's see. Oh man, it froze. All right. So I don't know if you guys can hear me, but I'm going to try to. I'm going to have to undo this. Everything's frozen. Okay, coming back. Even the computer doesn't want to. Let's try it again. Sorry, that was the silent treatment I was giving you. All right, let's try it again. I don't know what went on there. Boom, boom. Okay. Hopefully this is going to work this time. Can you hear me and can you see this? Mr. Brown, yes sir. You got your hand raised.
Mr. T, I got a question about last night's homework.
Okay, hit me.
The one about the suprahyoids and the infrahyoids, did you grade those ones?
I probably did, but it's been a while. What did the question say, sir?
I just wanted to know if you graded mine to read my response.
Oh, all right. I have not graded yours. Actually, Mr. Ibarra is probably going to grade it, but I will specifically read your response because now I'm curious.
Okay. I just wanted to know if that was an acceptable answer.
And I take it this is an answer that should be between you and I?
No, it's fine.
Oh.
I mean...
Oh. So you want to just... Okay, go ahead.
Question,
tell me.
The question was, it was about the digastric. The digastric, it said, should the digastric be included in the hyoid group? Yeah. And if so, would it be a suprahyoid or an infrahyoid?
Good. And what did you say, sir?
I said yes. And it should be included in the suprahyoid simply because it's above the hyoid.
Yeah. Sir, you could have said yes or no. By the way, I 100% agree with your answer. That's exactly what I would have said. So I love it. But you could have even said, no, it shouldn't be, and I'll explain why in a minute. But the second part, everybody should say, if it's a hyoid, it's definitely a suprahyoid for exactly the reason you said. It is above, the digastric is above my hyoid bone. So yes, if the digastric's a hyoid, if the digastric's a hyoid muscle, it's a suprahyoid muscle for sure. And I don't think any anybody in the world would argue with that. What people do argue with is whether it's a hyoid muscle or not. And we'll see in a second why they argue about that. It's kind of cute. By the way, it's simple for me to remember it. It's essentially, and nobody would argue this either, it acts like a hyoid muscle. It's in the right place. It's doing hyoid things. You'll see here in a second. So, but good job, sir. Yeah, that's 100%.
And I just asked because I remember a little bit ago, you read one of my responses and you said you always love them because I put my personality in it. So I didn't know if you read it or not.
Yeah, reading your homework stuff is like talking to you. It's got this very subtle kind of humor running through it too, and you still answer the homework. So I'm still gonna go read it. All right. Okay. So hyoid muscles. You guys can kind of see them here. These ones down here. This is the hyoid bone. Remember, the hyoid bone is a floating bone, right? I learned in this class that there are other floating bones, but anyway, it's a floating bone. It's held up by all these muscles. It doesn't attach to any other bone. And it's a horseshoe-shaped bone, and it's actually very weak. You can crush it. I don't mean you have to worry when you bump into somebody's throat that you're going to break their bone, but it can be crushed. And there are muscles above it, 4 muscles above it that are essentially the suprahyoids that help move it up and down above it, and there's 4 below it that help pull it back down. Yes, Miss Mejia.
What's the purpose? Is this for like talking or like eating?
Yes, yes.
Is there anything else?
Talking, eating. That's it. Yeah.
Okay.
It helps you control your tongue and your throat, and also, and don't ask me how, I honestly don't know all the intricacies, but it helps you control, it is hooked to your tongue and all sorts of stuff. It helps you control your tongue and your throat so that, yes, you can do these really complicated things, because we can all go to dinner together, which would be fun. We can all go to dinner together, and we can be eating and swallowing food and still kind of talking. And that's actually really amazing that we can do all that stuff. And the hyoid bone and the movement of all the muscles it's connected to helps us control our tongue and our throat and all that kind of stuff, yes. So it is for eating and talking. Not the only thing for eating and talking, obviously, but yes, it is tied into that. And the trick, and the fact that we use our mouths for 3 different things: communicating, breathing, and eating. Yeah. You know. Cool. All right. Moving right along. Here's another look at the suprahyoids up here. You can see the mylohyoid up here. Yep. You can see all sorts of stuff. Stylohyoid, all sorts of stuff. We're going to look at these separately. Again, we're not going to memorize these, but this, can you see what I meant? Like if you put your hand up here, you're touching 4 suprahyoid muscles essentially. They might run off to different places back where you're touching them. And if you go down here, you're touching things like the sternohyoid and the omohyoid and the sternothyroid and the sternohyoid, and it just goes on and on. So anyway, let me show you. Okay. Yes, Miss Trotter, sorry. I forget that Miss Trotter's here. And she's very close, yes.
So I figured you like massage the suprahyoids, but would you really massage the...
So Miss Trotter's saying, I know we massage the suprahyoids because a lot of us will trace the bottom of a jaw and stuff. I don't know if you guys do. I actually don't do it in my massage, but I strangely enough love it when other people do it to me, so I should follow my own advice and do it. But they'll sometimes come under your jaw and kind of trace like along it under here. And it's nice. We don't normally, you're right, we don't, to answer your question, we don't normally massage the ones down here because then we'd be doing this. And there's not a lot of reason. But you could, I guess, gently. Nothing wrong with it. Yeah. So, essentially, no. Uppers and not lowers. Not that it's wrong. It's just not common, and I don't know. I don't think people would like it. Yeah.
Feel uncomfortable.
Yeah, a little uncomfortable, Miss Sardo. Yeah, exactly.
They probably think you're gonna try to choke them.
Yeah. So, this slide is of 3 true suprahyoids and a 4th one called the digastric. So let's first talk about they're all above the hyoid bone though, which is why I just put all 4 into that category. It's just easier for my brain and it makes sense. But I'll explain why the digastric is not in that category. So, but let's first look at the 3 suprahyoid muscles. We're going to end up with 4 because we're going to include digastric here in a second. But the 3 true suprahyoid muscles are the mylohyoid that makes up kind of the base of your mouth here. Yep. The stylohyoid, and can we see the other one? Oh, and the geniohyoid here. So, if you also look back here at the digastric, di means 2 and gastric means belly. This is a two-bellied muscle. It's got a belly here and a belly back here for the digastric. By the way, the digastric runs from your jaw to your mastoid process. It is the fourth muscle that attaches to your mastoid process. It is deep inside your mastoid process. Deep. Underneath the longissimus, underneath the sternocleidomastoid, underneath the splenius capitis. It's deep in here. But it is attached to the mastoid process. It runs from here into the mastoid process. The reason that they claim that they don't call it, what I want to say, the reason that they claim that they don't call it a suprahyoid is it never touches the hyoid bone. All the other supra and infrahyoids actually insert and touch the hyoid bone and attach it somewhere else. If you look at the digastric, it's really weird, but it runs through a little ligament that's attached. There's a ligament on the hyoid bone that's a sling, and the digastric goes under it, and the hyoid bone sits on it. And the digastric tightens up, by the way, it kind of lifts up the hyoid bone, and when it loosens up, it drops it back down. But it doesn't touch the hyoid bone. Now, I don't know what the difference is, personally speaking. To me, it is touching the hyoid bone through that ligament, but that's why it's not named a suprahyoid. Because it doesn't actually sew into the hyoid bone, and all the other stuff does. All the other stuff does. So the mylohyoid actually goes from inside your jaw and actually sews into the hyoid bone. And the geniohyoid actually comes from the tip of your jaw here and sews into the hyoid bone. And the stylohyoid, crazy, 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 the stylohyoid hooks to your hyoid bone and goes all the way back. I don't even know if you guys can see this, but it goes all the way back to this pointy little spot that's called the styloid process of the temporal bone. It is another feature of the temporal bone. It's deep inside, you'll never touch it. If you do, you've probably killed your client. But there's a tiny toothpick bone here that actually attaches from here down to the hyoid bone, and it's called the stylohyoid, and it directly connects to it. So, that's why the digastric is not actually called a suprahyoid. That's it. So I just call all of them suprahyoids. Just makes sense. Yes, Ms. Sardo.
If someone cannot talk, and if we work on this or the muscle under here and break it loose and they can talk.
Yes, I believe that. I also had a really interesting student take this class once, and she had a PhD in I don't know, child adaptive therapy or something. I don't know. Really smart lady, and they used to do physical therapy on people and all sorts of really interesting stuff. And she was 100% convinced that your hyoid bone being stuck actually led to shoulder tension and all sorts of other things. And she would actually even have you, when she's working in a tight spot, she'd ask you to swallow like that, because she said it would help kind of reset the hyoid bone. I have no evidence of this, by the way, but I have to say she was wicked smart. And anyway, so she thought, you're right, Ms. Sardo, that all of this had important stuff to do, which is actually one of the reasons, I mean, I taught this before, but it's one of the reasons I keep teaching it. I do think tension in this area can affect people's ability to speak, for sure, and stress and all that kind of stuff. So just like we lock up our jaws, this might tie into TMJ. It sure doesn't hurt. You already got your fingers inside their ears. You've already rubbed all this stuff. At least get the suprahyoids, right? And strangely enough, two of the suprahyoids, the digastric and the stylohyoid, insert into the temporal bone, which is where the temporal mandibular joint is. And it's very hard to tell from here, but that's your ear hole, and the styloid process is right there. Right by the ear hole. And the mastoid process is right there. So we are talking about a lot of stuff really close to each other, so there really could be a lot of this TMJ problems along with suprahyoid problems. It's worth exploring. It's worth at least loosening this area. I agree with you. Nothing to lose.
And they connect they connect with the problem about hearing. They can see,
yes,
but cannot talk and cannot hear.
Yes. It can cause problems with hearing, for sure. For sure.
I see in Thailand and they cannot talk. They born with the this that and then they go some specialist and they work on this area
I agree.
and they can spell it.
I have personally experienced receiving a massage before where afterwards I could hear better. I've had massages where I could see better afterwards too. Like literally my vision was, because the tension in here was causing problems with that, and I'd get up off the table and I'd be like, oh my gosh. Like I can actually see stuff farther away and I can hear stuff clearer. Yeah, 100% agree.
One more question.
Yes, please.
They connect with the hearing, the eye, and the nose also, and the mouth.
Yeah. Do wait. Oh, yeah.
Do you agree with me? I think the whole thing.
I don't know that they connect with the eye, but I agree with you that tension in that area can cause this whole complex to have problems. I agree with you that people seem to get these related symptoms of poor vision, poor hearing, tight jaw, tight hyoids, and it all seems to be related. Yes. Yes, I've seen lots of that. Lots of it. There's definitely something going on there. And by the way, nobody's fully figured it out, so I hope one of you will.
Because I'm trying to get like yes or no, and this I understand it in my sorry,
No,
I
it's okay.
say when my understanding it yes or no, and do you agree with what I
Yes.
I
Yes.
keep it out with you or with all the friends I here agree about what we should work to help TMJ and loosen up with the muscle.
Yes. I agree. You should work this when you're working TMJ. I agree. Yeah. Yeah. And this is really helpful, everybody, because in TMJ, we're trying to make a very tiny difference. It was probably a very tiny difference that got them that point. So once you loosen up their shoulders and their neck and their pec minors and their subclavius, and you get the scalenes and all that kind of stuff, and then you get up here and get the masseter and the temporalis and the lateral pterygoids, and you get the suprahyoids, all of a sudden, sometimes you can make really big change. Yeah. Yeah, anyway, the short answer, Miss Sardo, is yes. All right, everybody. So that's the suprahyoids. There's essentially 4 of them. I don't go around. I honestly don't know if I could name them off the top of my head. Maybe I could, but I just kind of remember there's a myohyoid here. I always forget about the geniohyoid right here, but it's all in this. They rub them together like they're in the same spot, so I don't have to remember. I just know that there's suprahyoids, infrahyoids. Rub them all together. And I can't get to the digastric and the stylohyoid back here. I can still only touch them here. So the only stuff I can work on is right here. So if you just remember, there's essentially 4 suprahyoids here, and rub the bottom of the jaw. Done. And then if we flip it down, boom. They're almost this length too, and they're almost right here. Just right in here. This will be your infrahyoids. Boom. Hold on. Hold on 1 second, everybody. Yes, sir? Do you need me? Do I get spray?
Your next break. I got a question about homework.
Oh, okay. I'll come see you in just a minute. All right. Here are the infrahyoids. You got the thyrohyoid because it actually hooks from the hyoid bone down to the thyroid cartilage, not the thyroid gland. And the sternothyroid that goes from the thyroid cartilage to the sternum. Yeah? And you've got the sternohyoid that goes straight from the hyoid bone to the sternum. I don't memorize these either. I just know they're right here. But I would like you to remember the omohyoid, because it's fascinating and it makes me wonder. So, for the omohyoid, you can tell the insertion is on the hyoid bone. All hyoids, supra or infra, are inserted into the hyoid bone. All of them do. All of them. That's why they're called that. But what is the origin of the omohyoid?
It's the superior border of the scapula.
Yeah. So you have a muscle, and we don't know why. You have a muscle that's running from your hyoid bone down through here and actually inserts on the top of your scapula. We just don't know why. And my student who's the PhD swore that that's part of the reasons you see connections between tension, shoulder tension, neck tension, TMJ, all that stuff, that was part of the problem. I think it's an extremely unusual thing to do, to hook a tiny little bone that has to move in various ways with a shoulder thing that's going to move up and down anyway. It is a very interesting thing. But it could imply that shoulder tension could throw off my hyoid tension, all sorts of stuff. I wish I could tell you more. I wish I had something brilliant to say about that. I don't know. But I do know that everything else in anatomy that I've learned when it comes to muscular anatomy, the muscles have a really good reason for being there. And it's a very strange connection. And it's worth mentioning to you so that one of you can figure it out and come to me on my deathbed and be like, Tapscott, if you push on this thing, it releases all this other stuff, and I figured out this amazing way to do it, and the omohyoid is hooked to the scapula because, and I'll be like, thank you. Yeah, like that. That's what I imagine. All right? So no pressure. You've got somewhere between a day and 50 years. I don't know, but get on it, okay? So that's suprahyoids, infrahyoids, suprahyoids, infrahyoids, 8 in total. All of them insert, 7 of them insert directly in the hyoid bone. There's the digastric that goes through a hammock, a sling, still holds up the hyoid bone. It might as well be a hyoid muscle. It's just easier to remember it that way. And that's it. This is a neat picture, though, of the omohyoid here, going do. I'm going to grab onto the scapula. Cannot figure it out for the life of me. This keeps me awake at night. Yeah. All right, everybody. That's the hyoids. Yeah? All right. And I don't know if this is good news or bad news, but we're going to take another break because Mr. Ibarra has a question to ask me, and I know that we're all a little burned out. So let's take another 10-minute break. We'll come back before we pick up more exciting random muscles that I have no idea what they do.